NCDC before we take your questions. I now invite the SGF and Chairman of the Presidential Task Force on COVID-19 to please come to the podium to make his remarks.
Members of the Presidential Task Force, distinguished ladies and gentlemen, gentlemen of the press, good afternoon. I welcome you to the national briefing for today, Thursday, 30th April 2020. In my briefing of yesterday, Wednesday, 29th April 2020, I provided highlights of the new COVID-19 control measures announced by Mr. President in his broadcast, as well as key elements of the implementation strategy and guidelines, easing of the lockdown in FCT, Lagos, and Ogun states. I also intimated you of our efforts in collaborating with the government and people of Kano State, especially in providing all the necessary support to prevent the state from becoming the epicenter of the COVID-19 pandemic. As we approach the commencement of the first of the three-phased easing of lockdown from Monday, May 4th, 2020, it is important that Nigerians receive and digest the implementation guidelines. It is also important for state, law enforcement agents, trade associations, employers, businesses, and citizens to understand their roles, obligations, and responsibilities. Above all, we must understand that this is still a war against an unseen and potent enemy. No one should mistake the easing of restrictions for permission to act without care. The security agents have been instructed to respect the rights of citizens while also ensuring strict enforcement. The Presidential Task Force is adopting a combination of channels to create enhanced awareness and understanding of these new guidelines. These include 1. Publication in print media and traditional and social media, broadcast on electronic media, dissemination in local languages, and the use of the National Orientation Agency, NOA, in disseminating to all the 774 local government areas of the country. To complement the above, members of the Presidential Task Force will be in different television and radio programs to elucidate these guidelines. Ladies and gentlemen of the press, as you know, our national response is driven by strong collaboration with subnational levels of government. In this regard, I'm glad to mention that Lagos State has already adopted these implementation guidelines, while other states are also expected to follow suit shortly. The Presidential Task Force on COVID-19 still continues to engage the Kano State government in the collaborative effort to fight the spread of the virus. The high-level technical team sent to Kano on Monday has already submitted its interim report. The proactive leadership of the Kano State governor in managing the emerging challenges is highly commendable. I wish to use the opportunity to reassure Nigerians resident in Kano that the federal government, and particularly the Presidential Task Force, is with them and shall do all possible to fight the spread in the state as directed by the President. Kano is one of our historical cities and remains the backbone for the economy of this nation. I wish to inform you that already established isolation and treatment centers with holding capacity of 274 persons, the proposed establishment of additional facilities with capacity for 500 persons, 2 sample collection centers along with 6 new proposed centers have provided a strong foundation for tackling the spread of the virus in Kano State. Similarly, the Nigerian military, under its COVID-19 response plan, will establish an additional isolation center, treatment facility, and a testing laboratory in service in Kano State. The Presidential Task Force COVID-19 in the immediate will further strengthen Kano State to scale up its response with the provision of necessary facilities and equipment, capacity building, improving stakeholder interface and guidance on an existing policy capable of diminishing the fight against the pandemic in the state. Already, the testing laboratories in the Aminu Kano Teaching Hospital and the Bayero University, Kano, have become fully functional. The Presidential Task Force has released a number of equipment to be transported immediately to Kano to beef up the response. These include 2 oxygen concentrates and 3 ventilators, 280 protective gowns, 51 face shields, 538 examination gloves, 25 boot covers, medical masks and surgical caps, and infrared thermometers. I am confident that the above collaboration, complemented by the lockdown directed by Mr. President, will be effective in slowing down the spread while we continue to test, detect, isolate, contact trace, and manage cases. Also, the ongoing investigation into the causes of the recently reported high number of deaths will be pursued to its logical conclusion. At this point, I wish to announce with sadness that the National Coordinator, Dr. Sani Aliyu, lost his father yesterday in the evening. We commiserate with him and we pray that the Almighty shall forgive his sins and grant the deceased eternal rest. We also pray for God to strengthen Dr. Sani Aliyu and members of his family at this very difficult time. In addition to the updates by the Minister of Health, the DG, Center for Disease Control, ministers, if the need arises, will take turn to also brief you before your questions are taken. I now invite the Honorable Minister of Health to update Nigerians. Thank you.
Good afternoon, everybody. The Secretary to the Government of the Federation, honorable ministers here present, directors and directors general, ladies and gentlemen. What I will say will build on what the Secretary to the Government has already said. And it is that as of today, the 30th of April, 2020, 1,728 people have been confirmed to have the COVID-19 infection. The 196 new cases are distributed as follows: 87 in Lagos, 24 in Kano, 18 in Gombe, 17 in Kaduna, 16 in the Federal Capital Territory, 10 in Katsina, 8 in Sokoto, 7 in Edo, 6 in Borno, and 1 each in Adamawa, Ebonyi, and Yobe. Happily, 307 persons have been successfully treated and discharged home, showing that COVID-19 is curable. But sadly, 51 deaths have been recorded. Active community transmission and scale-up of case finding are expressed in the increasing numbers of confirmed persons you just heard. And as I stated yesterday, bed spaces and isolation centers at state level need to match this increase, and necessitates my appeal to all citizens, especially property and hotel owners, to recognize the imminent needs and the social responsibility of working with state governments and the federal government to make facilities available for temporary use in emergency situations. It is of concern to us all that everything should not be left to government alone. We must all take collective ownership of the health and well-being of our citizens. As community transmission emerges, the Federal Ministry of Health has brought in manpower capacity from the National Primary Healthcare Development Agency to strengthen and integrate risk communication with the planned training of primary healthcare workers and also community mobilizers to identify new cases and drive demand for COVID-19 testing while continuing to maintain normal outpatient service. I commend the Executive Director of the National Primary Healthcare Agency for this initiative. This ensures that health services provision does not suffer at the primary healthcare level, but also that health workforce remains safe. NPHCDA will anchor community engagement and mobilization for COVID-19. The Ministerial task team that was sent on a fact-finding mission to Kano has sent in an interim report which provided information on the needs, the strengths, and weaknesses of the Kano response system. While I await a full report, this will guide the Federal Ministry of Health and PTF in supporting Kano State COVID-19 Task Force with necessary material, training, and human resources. They will include assembling and dispatching a technical team from Federal Ministry of Health and also from the Infectious Disease Hospital in Irua to join a technical team from Lagos Ministry of Health, which is already on ground in Kano at the request of His Excellency the Governor. There will therefore be a good pool of very experienced hands-on experts to support the leading role of Kano State in the response. An emergency medical team from the Federal Ministry of Health has also left Abuja with ambulances, 5 of them kindly donated by Federal Road Safety Corps, on their way to Kano to provide emergency service in view of movement restrictions arising from the lockdown. I shall, as usual, request all citizens to adhere to advisories, stay home and do not travel anywhere because there is no call for everyone to return to their village. You are safe where you are, and if anything happens to you, you will receive good treatment there. Wear a mask or a face covering if you must go out of your house, and make sure to wash your mask every day and iron it if possible. Also wash your hands regularly and practice respiratory hygiene. Remember social distancing, avoid crowds, and inform those around you of these advisories. I once again call on all health workers to stringently follow laid down standard infection prevention and control measures at all times and not to take any risks. We cannot afford to lose the service of essential manpower at this time. Every client coming to your facility should be treated with respect, but with a high index of suspicion for COVID-19. But still, every client with fairness, so that persons suffering from other ailments do not suffer neglect or treatment refusal. It is not ethical to turn clients away without at least giving them a medical advice. Neither should a person in distress be refused care in an emergency situation. The advisory on case management is accessible online. Resources and real-time information on COVID-19 can be found in the social media in the social media handles of Federal Ministry of Health and NCDC, the Federal Ministry of Health website, and the NCDC COVID-19 microsite are well known, covid19.ncdc.gov.ng. Thank you. I will now invite the Director General of the Nigeria Center for Disease Control to speak.
So, thank you, Chair, Honorable Ministers, ladies and gentlemen of the press. Thank you again for coming for another press briefing. Like I've said severally, we're in the process of scaling up testing across the country. And the key component that has changed in this is at least in Lagos, Abuja, and Kano, instead of waiting for people necessarily to call us, we are now going to where the patients are. So we've set up specific testing locations, of course in collaboration and under the leadership of the states, in these 3 states, to increase the throughput of samples being collected from cases that actually do meet the case definition. So we are now just not waiting for patients to come, we're going into the communities, into the health centers to identify people that meet this case definition and bring them in. We are doing this because we are now fairly certain that we do have ongoing community transmission, especially in these 3 cities, and we have to adapt our response to this situation, and we are doing this all the time. Our response strategy is an adaptive one. We adapt it to the circumstances in every state, every city where the nature of transmission changes. These changes means that more and more people will be going into the community. What does this mean? For us to go into your community, you have to accept us in. You have to be willing to accept the healthcare workers and support them and not stigmatize them. So all our healthcare workers are now trained to go in quietly, not to attract a lot of attention, but we really need Nigerians to support the work that they do and not stigmatize them or not stigmatize the communities in which they do their work. We're living currently, and this is a global phenomenon, we're living literally with COVID-19, but not the way we thought about it during the HIV era. So when we say we're living with HIV, we're talking about individuals and of course communities as well. But this really is about communities. How can we as a country manage this as we transit into the next weeks? As we release the guidelines of implementing the non-pharmaceutical interventions that will be released very soon and was announced yesterday. We're doing this in the context of rising cases. And how do we manage these 2 phenomena? We have to manage it by recognizing that yes, we still have cases, but yes, we have to start up some level of activities in order to balance these 2. We have to find a way of living with this disease and living with it in a way that we can control it, manage it, and continue aggressively responding to it. This will need the collaboration of all of us. Finally, a few words about Kano. Our response is improving. We now have 2 labs functioning. We have a 3rd one set up, and hopefully will go live by the weekend. The entire operations from identifying suspect cases, collecting samples, getting them into care, and assuring that the whole process is working is improving. Improvements in public health are sometimes not obvious to see, but we're managing this very carefully, speaking to the colleagues, and together with the joint NCDC-WHO teams that are combined in supporting the Kano State team, I'm happy to report that things are improving and will continue to improve. And I really thank everyone that has come to the table to support us with staff, colleagues, vehicles, logistics, coming together as one team under one leadership to support the efforts in Kano. These efforts in Kano are led by the Kano State government. We are there to support, and this support will continue as long as it's necessary. So we are in a marathon, not a sprint, like I always say. Improvements are gradual and not obviously visible from time to time, but I have every confidence that the work that we're doing in Kano will yield results, and we'll very soon see improvements in Kano like we've seen across the country. So I really want to encourage all our colleagues working at the state level, not only in Kano, but in 32 states right now, to persevere in efforts, pushing. Together we'll get ahead of this. Thank you very much.
Thank you very much. We shall now take the questions. If you're ready.
The Chairman, members of the task force, my colleagues, my name is Amaka Ode. I report for Arise News, and my first question is for the Minister of Health. Well, sir, some time ago you spoke to us about the psychologists as well as the emotional therapists that work in these isolation centers to help those who have been confirmed to have COVID-19, help them get through what they're facing. But my question really is, are we planning to expand their work to the frontline workers? Because we're getting reports of frontline workers in other countries who are taking their own lives because of what they are faced with, helping people deal with COVID-19. So would like to get your take on that, really. And my next question is to the DG of the NCDC. Well, sir, several times you've told us here that the results from the rapid test are not very reliable, but we're seeing state governments from different parts of the country, buy this rapid test and even the mobile testing facilities that, of course, we're talking about rapid testing, and this is a way for them to do it. So I want to know if you're still sticking with what you said with regards to the rapid test results are not as reliable as the results we get from the molecular tests that we're currently conducting in the country. And of course, the Minister of Interior, sir, coming to you, I don't know if you've seen the report out of Morocco where about 313 prisoners have tested positive for COVID-19. So I want to know what we're doing here in the country to ensure that our already congested prisons don't see any confirmed case. So would like an update from you. And finally, to the chairman of the task force. Well, I'm sure you've seen the report of confirmed cases escaping from the isolation centers. I know the isolation centers, you say, is not in the hands of the PTF, it's in the hands of the state governments. But of course, COVID-19 is all of us. It's our fight. So what is the PTF doing really to ensure that we have at least perimeter fencing and all those sorts of, security to ensure that these people, yes, it's not their fault, they're positive, but they are positive, so they need to stay in the isolation centers to get well. Thank you.
Good afternoon, everybody. Rachel Abuja from the News Agency of Nigeria. My first question is to the DG NCDC. So NCDC has been trending throughout the whole of the day over an alleged NCDC bill. I don't know if you would like to educate Nigerians more on this. More so, are we looking at modifying our case definition to accommodate other things? Meanwhile, yesterday you spoke about state governors calling on you for more laboratories in their state, but let's not forget that the labs we have now are underused, and I hope you are telling them about what it takes to take care of or maintain a PCR. My next question is for the Minister of Interior or Minister of Foreign Affairs. Now, we all know what's happening in the southern part of Cameroon, and I don't know if our government is reaching out to the government of Cameroon in order for them to resolve this issue, because as it is now, we have community spread in that Anglophone area of Cameroon. And thanks to Benue, Taraba, and Cross River State for helping us to man our borders. But some Nigerians will say the federal government needs to do more in order to secure our borders. So I would like to know how far or what the state of our borders are, if we're having challenges or not. Then also for the chairman, some Nigerians in Cameroon are crying to come back home They've been refugees there. So I wish the Minister of Humanitarian is here to take this, because while we are trying to bring back people from China, we should be looking at for people that are not actually far from us. Many thanks.
Good afternoon. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My question is to the SGF, sir. It is obvious that the government is ready to kickstart the economy. One can understand this from the President's speech on Monday and the ease of lockdown guidelines rolled out yesterday by this committee. We have seen the impact of the government policies on diversification of the economy, especially on food security, to produce what we eat and eat what we produce. My question, sir, is as the government prepares for the post-corona pandemic, are we likely to see any shift in policy focus? The world witnessed this kind of changes after Spanish flu in 1920s and the World War II that ushered economic prosperity in Europe, Asia, and America. Sakataren gwamnatin tarayya, bayan wannan corona ta wuce, yanzu da alama gwamnati ta shirya wato abun da ya shafi tattalin arziki ka abun da ya shafi wato shirye-shirye da ake, ko za mu ga wani abu sabo na sauyi, domin mun ga yadda waɗansu matakai da wani su ɗauka, musamman maganar a koma gona ta yi amfani a yanzu. Shi akwai wani shiri da aka yi musamman na haɓaka tattalin arzikin da ke tangal-tangal a yanzu bayan wucewar wannan ciwo? Minister of Information, sir, yesterday you made mention the devastating effect of coronavirus in the creative industry as one of the biggest contributors to the GDP. You didn't say anything about the media industry, sir. Most especially as their sources of revenue dries up due to effect of coronavirus. Media houses under the Broadcasting Organization of Nigeria, sir, issued a statement a week ago about the impending danger of shutting down in this era of fake news. Millions of jobs are at stake, sir. Any plans for this important industry? Thank you very much.
Good afternoon, the Chairman, Ministers, my colleagues. My question is more of a clarification, and it's to the SGF. With the easing up of lockdown by next week, I want to confirm some civil servants were in other states undergoing training before the lockdown commenced. Now that they will be going back to work, would they be allowed to come back to their base? Thank you.
Good evening, the SGF, Honorable Ministers, and my colleagues. My name is Rahila. I report for Voice of Nigeria. My question goes to the SGF. Recently, we've recorded a surge in the infections on people still under the lockdown coming in from other states. Like there was a video of a guy who traveled all the way from Lagos to Ekiti. Now, in the face of this, and the government is planning to ease the restriction by next week, how are we ready for this? How do we curb this? Secondly, there are senior civil servants living in neighboring states like Niger. People come all the way from Suleja and Kefi to work in the city center. What's going to happen to them? Because some of them are not mobile, and with the ban on interstate travel, is there any plan for them? Thank you.
Good afternoon, sirs. My name is Juliana Taiwo Balonye. I write for the Sun newspapers. SGF, sir, this is for you. Your comment on importing Madagascar solution has been trending since morning. And an Abuja-based journalist, Innocent Uwe, says life has returned to normalcy in Madagascar and Senegal, and both countries look inward to resolve their problems. What has Nigeria learned, and how are we going to toe that line? Minister of Information, a follow-up to what my colleague said. Somebody who watched you from or your state says already the creative industry has been granted palliative before, and you are planning to give them again, but you seem to have ignored the book industry, who have also been hard hit by this coronavirus pandemic. So he wants to know what is government plans to assist the industry to stay afloat. Thank you.
Good afternoon, sirs. My name is Friday Okerigbe. I'm a reporter with Channels TV. The first question I have, I would like to seek confirmation from the Minister of Health. Just this afternoon, the president of the Nigeria resident doctors actually said that of the almost 2,000 cases that we have, 366 of them are medical doctors. Yes, that's what they said this afternoon. So we'd like to know, is it true? And the alleged reason behind it is that many of them working in some of the centers, they do not have adequate protective equipment. That is one of the reasons. So we'd like to hear from you about this. Then the second, I will appreciate the SGF to actually do little more elaboration on that. Yesterday, you told us about the 6 weeks, into 2 weeks, plans to rejuvenate the economy. You only explained the first 2 weeks, which has to do with the banks coming back to work, some offices like the National Coordinator mentioned, food processing organizations, some government offices. What will be the other 2 phases of the 3 phases? We would like to hear more about that. And also, I would also like to find out from either the Minister of Health or the DG NCDC can actually take this up. What specific preparations do we really have to manage the possible surge in the number of cases? I've not really seen it. Because in the last 2 days, like my previous colleague said, from 195, we got 196, and the DG NCDC actually said it now, that we should prepare for more cases because more testing will be done. Apart from testing, what actual preparation do we have to ensure that these cases that we're anticipating, that will grow over the weeks ahead, we can actually manage them in the isolation centers? Thank you.
Good afternoon all. My name is Abbas Adibawale Jima from Daily Trust. The first question is for the Minister of Health. The other time you released the guideline for some palliative for the frontline health workers. And those in the environmental health officials, they were not mentioned, despite being among the front line that were most of the time, or even the first post of call before those who will be discovered will be referred to the other side. So what's going to be their fate? The environmental health officials and other allied health workers that were not captured, what's going to be their fate in this insurance and other measures for them? And the second one is on the Almajiri, and this is for the national coordinator or the chairman. There are cases in Kano, Jigawa, and Kaduna that the Almajiris were confirmed as positive. And more than 30 CSOs who accompanied them, some of them were also tested positive and are in isolation. So Nigerians were now asking questions, what is going to happen? Will the government allow the state to handle this thing? Or are we going to just wait till something else happens with the rising number of cases and we are being moved from one state to the other? And the last one is that the Minister of Information mentioned some things on the media. The media industry, especially the private sector, are really, really bleeding, and nothing has been mentioned against them. And they are one of the most important partners in the COVID-19 war. So what is going to happen to the private sector as Nigerian media segment is concerned? Thank you.
Thank you. We have taken all the questions. and will be responding in the following order. The Honorable Minister of Health, followed by the DG NCDC. Then we'll take the Honorable Minister of Interior, Honorable Minister of Foreign Affairs. There are actually, there's a question directed straight to the Minister of Interior, and there's one between the Minister of Interior and Minister of Foreign Affairs. I do not know who will answer. Okay. Then the Honorable Minister of Information and Culture, finally, the SGF will round it up. So we'll begin with the Honorable Minister of Health.
Thank you very much. The first question is about the mental health strategy for what I'll call the back end, because the front end are those who are in treatment, but those who have been probably treated or diagnosed, is the main problem is first and foremost the question of stigma. I took time to announce the number of people who are recovered, to let everyone know that you actually can recover from the coronavirus infection. The recovery rate is 95% or more. So out of 100 people who get the corona infection, about 80 or so will have mild or no symptoms. 15 will have some fairly severe symptoms, but it won't be critical. And probably less than 5% will have critical symptoms or conditions. So what that means is that nobody needs to really be afraid that this is something that is so dangerous that I mean, it is dangerous in the fact that it can affect a large number of persons at once. It really affects the health system and brings the health system to its knees. And of the 5% that it really affected critically, there can be so many that the health system can be threatened. So there's no need for people to have that stigma. They should come up and seek treatment and not hide. The ones that we worry most about are those who go and hide or who go and look for alternative treatment, and they are lost to accounting. There is no reason for anybody to have feelings of exclusion or to think that they want to take their life on account of that. The mental health service can be extended to those who are tested and in treatment. There's no way of finding those others who are not yet diagnosed or who are diagnosed but are in hiding, except to make it very open as we are doing now, that there's no need for that. As for the doctors, what are the... Yes, I understand. Okay, I get that point. Yes. Okay. Now you do see what the SGF has said several times, that we are in a state of war. And you do see that also in war, there are people who have what they call the post-traumatic stress syndrome, and who do some irrational things. So to look at healthcare workers who are caring for the coronavirus, yes, I don't think we've had any such case. In the US, I think you say you had one. In other countries, they've had, maybe we haven't had that volume. But I think it is very important for healthcare workers to realize that nobody is conscripted, nobody is forced, everybody is a volunteer. Those who can't handle it generally have the option of requesting to be excused and someone else will come in. But the pressure on healthcare workers, if you have a crisis situation, can be quite severe. And I do think that mental health services can be, counseling can be extended to those who feel they are impacted in that way. We've seen that in some parts of Europe also. As for the doctors, over 300 doctors, that's a fable. That is not true. There are not so many people in the health sector who are affected. The latest figures we have is that there are about 113 actually, and these 113 are not all public health workers. There are some, for a good number from private hospitals. And if you hear us speaking here frequently against trying to treat coronavirus in private clinics, we're actually referring to people who do so without having necessary precautions, without having necessary training, because they risk infecting themselves and they go home and give this infection to their family, and that is not the right thing. So the healthcare workers who have no training, have no business actually handling coronavirus. As for those who do not have equipment, we have said that we've provided equipment for and PPE for all those who are out there. There are one or two places where we have heard that there's a tightness in supplies, and I've tried to send them over there. But let me remind you again that there's a global shortage of health PPEs. There's a global shortage. Many countries are struggling and hustling for PPEs, even for the gowns, for masks. And I remind you of an argument between two world powers over 200 masks. Some of you read about it, that were supposed to be delivered to one and seized by the other. So it tells you that these things are really scarce, and we are doing everything we can to make sure our frontline workers have these requirements, and that we also have a stockpile that we can send quickly. We, for example, heard the SGF say that we sent a stockpile very quickly to Kano just recently to make sure that there is no shortage. We're also looking at domestic manufacturing. There are some companies who have come forward that they can manufacture, and we are talking to them to place domestic order. And as far as masks is concerned, many people are already into the business of mask manufacturing. So domestic production will try to beat up with the demand in that area. As for the surge in case finding, it is true that we are getting a surge, and if you hear the announcement made by the DG of NCDC yesterday, it is that they want to do up to 2 million tests. Now, that will bring up a lot of cases, we know that, but that's the purpose, to bring up the cases and take care of them before they infect more people. And you also heard when I was speaking just now, appealing not only to state governments, but to citizens to make property available at temporarily for these purposes. So I'm sure that after that, there are many property owners who come up and look at their empty property and donate them for a period of time to the state government to be able to use for this facility, for this function. That's the reason why I made that appeal. We are going to look for bed spaces. We are not tight now. We are not out of space. But we are making that announcement and that appeal ahead of time so that we have these facilities and these spaces ready. And as His Excellency the President said, we want to be ready, but we hope we don't need them. We hope and pray that we don't need these facilities, but we need them to be present, to be there. So as for the palliatives, the negotiations had actually gone on between the health workers, that's the Ministry of Health, and the areas who are doing hands-on patient care, and the Ministry of Labor and so on. About the environmental health, I don't think they were in there, but I think maybe that can be looked into to see how much. Don't forget that this is a hazard allowance. Hazard allowance means when you have to do something that is hazardous or risky, which you cannot run away from. So if you don't do it, then you haven't asked for it. If you are supposed to do it and you back out, you can't take the money. And if you are taking the hazard, particularly of patient care, then you can make a case for it. I think if that is so, the PTF can listen to the case. It's a very fair-minded body. I think that's all that concerns the Ministry of Health. Thank you.
So thank you. Only 4 questions today. You were kind on me. So first it was the question on if state governments are buying RDTs. To be honest, we live in a federal structure. So every state government can still make its own purchasing and procurement decisions. We can only advise them. And our advice has remained consistent with what the evidence says and shows. The evidence at the moment is the rapid diagnostic kits don't have sufficient sensitivity, the ability to detect positive cases when they're positive, or specificity, the ability to detect negative cases when they're negative, in order for us to use as part of our strategy. And my responsibility is to make sure that every result we give people and say, yes, you have this disease, you have the highest likelihood that you do have it. And if you don't, you don't. So that's my role, and that's one of the mandates of the Nigeria Center for Disease Control, to provide government, our leaders, and state governments this evidence to make decisions. So I hope that they take advice. If not, they may actually put their own citizens at risk, and that is something we really don't want them to do. So we continue to advise everyone, not just state governments, the private sector, that we're working very hard with WHO every day to look at the evidence. There are few tests that are now going through validation, and once that is complete, we will provide those answers so that we can make those procurement decisions and make access easier. So far, whether you're in the US or in the UK, if you look around, they're all doing the same thing we are doing. Whether you go to South Africa, they're doing exactly the same thing. The only difference is they had a better developed underlying physical infrastructure to scale quickly. But the basics of what they're doing is exactly what we're doing here. The second question, I think it was Rachel that asked about the bill. To be honest, I saw the bill, just like you did yesterday, circulating on social media. And I take it in a good way. I think the members of the House of Reps, everybody's concerned about the situation and where we found ourselves in. And I think they are doing their very best to come up with solutions. The only solutions that they can come up with are new laws. So I take it positively that they are doing something. Of course, the bill requires more consultation. I am personally not in favor of drafting a bill in the middle of a crisis. I think we need to get over the crisis, get our heads around what has happened, and use the momentum to engage with all stakeholders to come up with a bill that will really serve this country for now, but serve it well into the future. Whatever new legislation we come up for public health and infectious diseases in Nigeria will be so important, because there has never been a time that the importance of this has been more clear in the consciousness of Nigerians. So we must think through each step carefully and come up with a bill that is really fit for purpose and serves us now, but also serves us well into the future. In terms of states asking for more labs and the ability to manage, I also take this as a good thing. We have said severally, our strategy here is really to have a molecular lab in every state and manage it through a hub and spoke approach, through using the national reference lab that is at NCDC, connecting to all the labs, make sure that we organize a supply chain and IT support, data. There are many components to a lab. People always think about it just as where you mix reagents. But you have to get the reagents to the labs, get the results back, move samples around. So it's a very complex process. But we want to get a connected and collaborative public health network in Nigeria that is no longer, as in the past, focused on TB or HIV or COVID-19. We want each lab to be able to diagnose any of the infectious diseases that are important for us. And that's a strategy the Honorable Minister has supported way before this outbreak, and we'll be working very hard post-outbreak to now implement it. In fact, starting from now, we've already started. Everything we do right now is working towards that goal. And I think the final question was Friday that asked about bed spaces. There's no doubt about it. We're struggling in certain places, especially Lagos. To an extent, Kano and Abuja too, but the biggest challenge right now is in Lagos, where bed spaces are really tight. Across the country, we have about 3,500 bed spaces identified as available for COVID-19, but in Lagos, we're already struggling. And so we're going to work with them to keep trying to make more spaces available, but ultimately we might have to change our strategy a little bit and start considering home care in certain circumstances where firstly, you're able to provide a room where a patient can be managed sufficiently, or secondly, we're able to support the care by enabling healthcare workers come to that. But we will always be honest with Nigerians. We are struggling at the moment. We might have to adapt our strategy because of the realities we face over the next few days and weeks. And as we do that, we'll make that clear to Nigerians. Our policy hasn't changed, but the pressure is there, and that might have to change in the next few days. Thank you. We've made a third change to our case definition. The most recent one was allowing testing in high-risk contacts that may not have symptoms. So we have modified and continue to modify that case definition, adapting to the realities of what we're finding. So right now, if you have high-risk contacts, i.e. you're the partner of a confirmed case, or you're a healthcare worker that has managed a confirmed case, and you now find out that the result comes out and the patient you managed 3 days ago became positive, we will then test you. If you're a partner of a confirmed case, we would also test you. So we're continually adapting our case definition to fit the response. Thank you.
Thank you. We will take the Honorable Minister of Interior.
Good afternoon, all Nigerians. We must thank ourselves for the resilience, perseverance, and forbearance. It's important that we thank ourselves for holding on this far and for keeping it up. Fighting an invisible enemy cannot be easy. By the grace of God and the support of all of us, we shall overcome. The question is that how are we holding on in the custodial centers to prevent the outbreak of COVID-19 in our 244 custodial centers in Nigeria? This is not the first time this question will be asked, and we have answered each time such query comes up. Yes, even in America, it's not only in Morocco. Even in America, custodial centers are breeding ground for COVID-19 infection and outbreak. So it's not new that such dangers really exist to have the outbreak of the virus in custodial centers. But due to the diligence of our officials, men and officers of the Nigerian Correctional Service, as tough as it is, they have maintained a crisis-free, absolutely crisis-free situation and regime in all the custodial centers under our care. A combination of professionalism and a strict adherence to the protocol established by the NCDC have made it possible for us to record till date a no virus outbreak in any one of our custodial centers. And we must thank the following people. We must thank the CJN and the NJC, the Minister of Justice, as we are thanking ourselves and the officers and men of the Nigerian Correctional Service who have helped in their different ways to ensure that, one, the NJC and the CJN, they have closed the courts substantially, and that has helped to reduce pressure on new intake, and we have equally stopped admission of any new intake into any of the custodial centers. The states are not too happy with that, but that's the minimum we can do to prevent importation or admission of any person who is positive to the virus. And the greatest appreciation must go to the president, who have put for us a phased decongestion of the prison. The first phase had occurred about 3.5 weeks ago, and we are still working on several other processes to ensure that we decongest the custodial center. So, the combination of decongestion, extreme adherence to rules of hygiene, physical distancing as much as possible, and regular check of officials and inmates, all have combined to support a crisis-free regime in the custodial centers under our watch. Before I sit down, I need to use the opportunity to pass on messages. No, the second question, before I even go to general, second question is, how are we preventing the eastern flank of the nation from incursion of virus-bearing people from Cameroon into our nation? Even Nigerians who are in Cameroon and who use Cameroon to enter our nation. One, there is a combined task force of the security, the army, the police, civil defense and immigration, patrolling in all the formations, because you have commands of the immigration and the police and the army in each of the states. They jointly patrol the borders, legal and illegal, on all the borders, land borders of Nigeria, particularly at the eastern flank of the nation, and they are doing a wonderful job. We are supported in this by the government, by the subnational government, at the flank, at that flank, and in all other areas, but particularly the eastern flank. We must commend the government of Borno, of Adamawa, of Taraba, of Benue, of Akwa Ibom, of Cross River, for their support in ensuring that we have a very watertight situation at the border. That's about the border. So there is no fear at all. We have the cooperation of all. Even the Navy too supports. The Navy supports in Cross River to prevent any undue incursion of people who could compromise our situation in Nigeria as far as COVID-19 is concerned. But I want to speak generally now, having responded to your question, which is, what should be our response to this pandemic? This is not my opinion. It's the opinion of Professor Wole Soyinka in an interview he granted a television station, I think TV Plus, African Plus television, if I'm right. And let me quote him. I should go a long way in elucidating what I intend to say. He said in that interview, and I'm quoting him, "This pandemonium is of such enormity that a new order must come out of it." Professor Wole Soyinka. And I want us to reflect on that statement. The effort we are making at the task force is to ensure that we all appreciate the enormity of this and our individual responsibilities in ensuring that even after this unfortunate phenomenon, we get out of it prepared, not only for the present, but for the future. So should there be in the farthest future, not in the nearest future, in the farthest future, this is 100 years' time, what legacy are we preparing to pass on to ensure that we will not have to go through this panic anymore? That is the need for us to look at how we change our attitude, how we change our culture, how we change how we relate to ourselves, how we live, how we trade, and several other things. And that is what I think this statement is trying to tell us. That a new order must emerge. A new order, a new social order, a new economic order, a new spiritual order. The order of society must change such that we will not have to go through this pain anymore. If at any time, God forbid it, there's a recurrence of this. And I thank you all for your attention. We are doing our best to protect Nigerians. As I must add, as we are commending the health workers, we must not fail to commend the security officials. They too are frontliners in the effort to combat COVID-19. We are struggling to provide them with protective equipment and gears, but they too are exposed. And I want to say that it's important for us to pray for them, commend them. Though there may be few incidents of exuberance, the majority of them are there to protect and ensure maintenance of law and order. I commend the officers and men of all security forces on behalf of all Nigerians. I thank you for your attention.
Honorable Minister of Information and Culture.
Mr. Chairman and members of the PTF COVID-19 Task Force, gentlemen of the press, I remember that some of the issues raised today were also raised, some of them were raised yesterday, and I would reiterate my position yesterday, which is that we are not oblivious of the fact that the creative industry, which of course also comprises the media, is the most badly affected by the COVID-19 pandemic, and that we are already working towards alleviating the challenges and difficulties that this has posed. As a matter of fact, as of yesterday when I was speaking to you, a stakeholder committee was holding in Lagos on the creative industry, and we are almost about getting ready the list of the special stakeholders committee that would address the issue of the post-COVID creative industry. As soon as we get the terms of reference, we will announce the membership and the terms of reference also. But we are working very hard to ensure that post-COVID-19, we would be able to resurrect the creative industry. And I'm confident that this will not be too much of a Herculean task, in the sense that the infrastructure for this has already been made available by government. You remember sometimes in 2018, I led a team of the creative industry stakeholders to meet the central bank, on how to provide finance and assistance for the industry. And I think, like I mentioned yesterday, the CBN Creative Industry Financing Initiative was as a result of that effort. So what we need to do is leverage this particular fund made available by central bank to revive the industry. Remember also that the Secretary Government reminded us that part of the intervention of CBN as soon as the pandemic broke was the 50 billion targeted fund, which is meant for SMEs, small households, and especially the hospitality industry. And these are things that these are the issues we are going to better synergize with the CBN to ensure that the creative industry actually does not suffer too much post-COVID-19. I want to remind you also that yesterday I said that the digital switchover will be quite a good, an effective panacea to the pandemic as it affects the creative industry, because the DSO that's the digital switchover, is capable of creating tens of thousands of jobs along the value chain. And I'm glad that we took advantage also of this pandemic when the committee for the fiscal responsibility, sustainability asked my ministry suggestion on the way forward post-COVID-19. We actually emphasized the need to quickly go out on a new rollout of the DSO. So we believe that with this, arrangements, it will not be too difficult to revive the industry. On the issue of the media, yes, like I said, when we talk about creative industry, it's not just the film industry or the music industry, actually also the media industry. And what we are going to do is that we've started engaging the various sectors of the media. As a matter of fact, the broadcasting organization will be meeting with my ministry either on Tuesday or on Wednesday, so that we can explore ways of, helping the broadcast industry, which we all agree is one of the biggest victims of this pandemic. All through this pandemic, I've always been in contact with the leadership of the newspapers, Proprietary Association of Nigeria, and we intend to also ramp up the meetings with them so that we can get a solution to the ailing, economy of the newspapers and the entire media industry. We're also not averse to meeting with the publishers, bookshops, because these are all these have been affected by the pandemic. Yesterday night, I received a call also from the leadership of the hoteliers who complained that all the hotels are shut and there's no business. Well, we are meeting with all these groups, individually. But I'm not under any illusion that it's going to be very easy. But I believe that if we work together with all the stakeholders, we will be able to revive the entire creative industry post-COVID-19. Because what we are witnessing today is not just a health challenge, it's also a direct assault at the economy of every country. Whether it is the travel industry, whether it is the manufacturing industry, whether it is the hospitality industry, every sector of the economy is affected by this pandemic. And I think it's this pandemic that has made us realize how very interconnected all the various sectors of the economy actually are. So I want to assure you that we are taking seriously the issue of reviving the economy post COVID-19, especially in the areas of the creative industry and in areas of the media. And as early as Tuesday or Wednesday, the first set of meetings along this line would take place, and then would also address each of the sectors, be it MPAN, the bond, or the hotel, the association of hospitality, operators. Thank you very much.
Now we take the SGF.
first question has to deal with how we can secure the isolation centers. Whether we should consider the issue of perimeter fencing of the facilities. I think invariably most of the facilities have perimeter fence. Most of them. I'm not saying all. And we have been in discussions with the security and armed forces about the need to provide surveillance and control over the isolation centers. I hope we'll be able to perfect that in the days and weeks ahead. But let me say this. Perimeter fence will not deter people from wanting to escape, because I saw a video clip of the Kenyan experience. A very high perimeter fence, but they were throwing their luggages across the fences and they were jumping and escaping. And I understood from the news that that same evening they were apprehended in a clubhouse where they had gone to just socialize. I've not verified the story, but I saw the clips, and I think most of you saw the clips of how they were jumping out of the perimeter fenced isolation center. If that is true, that is what is informing my position that perimeter fence will not stop anybody from wanting to escape. It's just for our people to develop the culture of and the sensitivity of the fact that they are not only a risk to themselves, but they are a risk to the larger community. If they escape into the community and they avoid care management and they go around, the dangers are that they will keep infecting people, and that would widen the scope. And for those kind of persons, it becomes extremely difficult for you to know who are their contacts, how to trace their contacts, because they have just disappeared into the thin air. So I think this is a passionate appeal. Now, once you exhibit the symptoms, and you go for a test, and your status is confirmed, and you are required to go into isolation, it is not, I wouldn't say, it is of your own self-interest and those of your loved ones to subject yourself to that isolation. The issue of refugees, I know that the Ministry of Humanitarian Affairs, Disaster Management and Social Development have got a policy for the evacuation of refugees and Nigerians all over the world. And I think they had the plan even before COVID-19. They had evacuated refugees from Cameroon into Yola. And from there, they were kept in a center where their locations and their states of origin were determined before they were now relocated back to their communities. Most of the refugees we have in Cameroon are refugees that arose as a result of the insurgency in the northeast. Most people, because we share borders with the Cameroon, I happen to come from one of those states, Adamawa. People can just cross over easily across hills, mountains, or rivers quite easily. So I believe that they will continue to pursue that policy of evacuating refugees. But you know, COVID-19 has kind of interrupted everything. Everything in the normal has been interrupted. So the priority now is how do we deal and contend with COVID-19 internally. But I believe that policy is still on, and I would find out from the Minister of Humanitarian Affairs how they are going about it and what are the steps that are being put in place. Somebody asked whether, now that we are opening up, what happens to civil servants who had gone to states of their origins during the lockdown. The truth about it is that they were not supposed to travel, but so they must find a way. They must find a way of coming back. The lockdown was supposed to keep everybody down. Yes. Well, there's always a way around that. Once those kind of claims are authenticated, there are passes that the states even give. We had to evacuate some of the staff of the Center for Disease Control all the way from the Democratic Republic of Congo. They went for a training and the lockdown caught them there. But they are essential staff of the center. So we had to get all sorts of exemptions to fly into Congo to lift them out because their services is much needed. They went for the same training that was being provided by the WHO, but it was in the Democratic Republic of Congo. So those kind of exemptions can be made for people who had gone for training, and now that the system is opening up gradually, they intend to return. Every effort will be made to ensure that they come back. But for those that left because of the lockdown, well, I think they are on their own, they will find their way. The question for whether we are ready for easing up of the lockdown. No country is ready. That's the truth about it. No country is ready. Look at all the countries. It's a balance. It's a very, very delicate balance that leaders in different countries take. It's really a difficult terrain. And I just don't envy the leaders when they receive reports and recommendations. I don't want to imagine what is going on in their heads, because this is a choice of life and death. And a balance of that deserves a lot of, how do I put it? A lot of resolve by the leader to do good for his people. So the choice that we have taken is to balance the health and also the wealth of the people in such a way that we do not further compromise the health of the people. The truth about it is that most countries take one step at a time. And that is what we are doing. We cannot tell you what would happen in the next couple of weeks, because that is the nature of the novel virus. It's unpredictable. You don't know how. You might be learning about it now in a different context and a different way, and the dynamics will change. And if you are not prepared to adjust quickly, you might be confronted with a very catastrophic situation. So for now, this is the choice that we have made. And that is why I always end up with a serious appeal to our people that is a collective choice. And this responsibility is collective. We must resolve to do what is needful to ensure that we do not escalate the spread of the virus. And the only way we can do that is, as much as government is easing up the lockdown to provide for succor for our people and the opportunities for them to make a living, they must also balance that with their commitment as citizens that they would do and adhere to the health advisories that have been issued out. Maintain social distancing, personal hygiene, stay at home unless it is necessary to go out, and all the other advisories that have been put in place. The other question has to do with life has returned to normal in Senegal and Madagascar. Are we going to look inward? Obviously, That was the crux of what I said yesterday, that we are open. The Ministry of Health, in conjunction with the Institute of Medical Research and the Pharmaceutical Institute too, are all collaborating to see how best we can develop our own indigenous, home-bred treatment or things that we can use for the management of cases that have arisen and that are going to arise. The only caveat there is that due process must be followed. If you have an invention or you have produced some form of solution for COVID-19, allow it to run the process. And the process will determine its efficacy. It will determine whether it is consumable by the humans or it has to go through some experimentation stage before it is applied on people. There are processes and there are protocols before a drug or a cure portion can be determined serviceable and also consumable before it is released to the public. I believe we would urge our homegrown systems and productions to go through that. I'm happy for Senegal and Madagascar. It's working in their country. We must also get something to work in our country. But that is also a drawback to our scientists, our experts. This is the time for call to duty, that they need to do what they need to do. The last question I have here is, what are the other two phases? This is very deliberate. We intend to take one step at a time. One of the reasons so that we do not create a bundle of confusion. If we say these are the businesses that would open, these are the timings for the businesses in phase one, which will take a period of 2 weeks. We want to remain with that. Let's try this and see how it plays out. Let's understand the regime and the protocol that goes with it. Throwing out so many stages out there will just create confusion and pandemonium. Most countries that have opened up have found spikes in their figures, and no sooner have they opened up, certain things are being put in place, not to entirely reverse the opening up, but to also try to ameliorate the spikes that they are seeing. So we will continue to do that. It's a very difficult process because on a daily basis you are looking at the map of the world, what is happening in other places, and you are trying to balance to see the best that will suit our people. We've never gone this way before. No country has ever gone this way before. Every country is at a standstill. Things that were normal in the past have totally been disrupted. Our cultural and social life is at a standstill. How can you imagine Nigerians not having a party on a weekend? I mean, it's a very serious issue. It's a very serious issue. Life will not be the same again after COVID-19 because we can see the interruptions that are taking place with our lives. You can see, I mean, totally. And I believe that if we cooperate together, that is my last word. If we work together, we will navigate this process. And at the end of it, we will build a very strong nation. Our resilience has shown it that in spite of the system, the failures of the system, in spite of the difficulties, in spite of the inadequate infrastructure, we are still holding on. I cannot but thank Nigerians more and more, and all of you that are out there working to ensure that we have a strong nation that can fight this COVID, and at the end of the day, we remain strong as a people and as a country. Akwai tambayar da aka yi a Hausa na cewa akwai wani abin da gwamnati take yi don tallafa kasa a wannan lokacin covid-19 din nan akwai jiya na yi magana na yi jawabi sosai akan kudaden da central bank ta kimanta biliyan 100 na manyan masana'anta irin kamfanoni na pharmaceutical da asibitoci wanda ake so su samu wannan kudin ta hanyar account nasu da bankunansu. Akwai kuma biliyan 50 na kananan masana'anta irin kananan masu jari, masu sayar da sayarwa, masu kananan hotel, masu gidajen abinci irin restaurant da su sauransu. Duk akwai shirin da aka domin su. Na tabbatar a cikin wannan tafiyar nan da ake daga bankoki suka buɗe kofofinsu daga 4 ga Mayu, duk wanda yake kokari don ya sake bunkasa kasuwancinsa da ayyukan kasuwancinsa zai fuskanci waɗannan bankuna. Ba central bank za ka je direct ba, za ka je bankinka ka yi tambaya ko kuma ka dubi website na central bank, za ka ga abin da ake ce guidelines wanda aka shimfiɗa, wanda in ka bi waɗannan guidelines ɗin da inda rabo za ka samu taimako daga wannan banki wanda zai taimaka maka duk asarar da aka yi na kwanaki kusan 30 ɗin da Allah zai taimaka mana don mu samu mu mai da gurbi na kasuwancinmu kuma mu bunkasa arzikin ƙasa. Na gode. Yes? Well, the question of Al-Majris, I've spoken about it. And I said it is the responsibility of government to provide for the welfare and the security of these minors. And it is very, very important that we take it seriously. I still repeat my words. I remember vividly. I said if we don't deal with the Al-Majri issue, we are building an army that would overwhelm us in the future. Even at this time, it is better for us to have them in one place. If they are moved to a particular location like I see the governors do, they quarantine them. They put them through the processes of the test, which is the most important thing to establish their status. Those that are positive, isolate them, manage their cases, and eventually, when they are negative, you now move them into the community back to their homes. The reason why they move them back to their states is so that they can take them back to their homes. The essence is not to just go and keep them in the camp. The camp now where they are is a holding center for their status to be determined. Might not be the best, but I think in the circumstances the governors are trying to ensure that they don't just release them back to their communities once their status have not been confirmed. I believe that's the best that they can do at this stage. And I believe that that will help tremendously to track infected people getting back into those communities. Thank you.
Thank you very much. That brings us to the end of today's national briefing. A very important announcement, the guidelines for the implementation of phase 1 of the easing of restrictions will be published this evening. It will be released as a press statement this evening, and the Director of Press, Mr. Bassi, will be circulating it to our colleagues in the media, and it will also be published in the newspapers from tomorrow by the grace of God. I, at this point, must thank our media partners. Again, we must thank NAPTIP, we must thank our viewers, we must thank those responding from home with questions and comments for staying with us all through this national briefing for today. 3 important messages came out of today's briefing. The first one is that Nigerians must understand that this is still a war against an unseen and potent enemy. No one should mistake the easing of restrictions for permission to act without care. 2, it's about stigmatization. Nigerians, please support the task of healthcare workers. Do not stigmatize them. Do not stigmatize the communities they work in. If you test positive, please do not go into hiding. Come out and receive treatment and care. Isolate yourself and do not escape from isolation centers if you have already gone there. Finally, it's from a grateful nation. A grateful nation says thank you to our health workers, to members of the media, to our security services, to environmental health workers, to everyone playing a role or discharging a responsibility in this battle. I thank you very much for being with us. God bless Nigeria. We hope to see you tomorrow.